Hello everyone. It's been a long day just finishing off and thought it would be a good idea to leave a small video on how to take care of your gums. As we grow older, the gums do get a lot of bashing and they get tired, they get damaged. Sometimes because we are all human, brushing is missed or you're not able to brush your teeth properly or you miss a few regions. Now, typically, what happens is in the lower teeth, you will tend to miss around the front anterior teeth towards the tongue side. So that's the inner side of the teeth. And in the upper teeth, that will be the back posterior aspect of the upper teeth. And usually we call it buccal side towards the cheek. So the cheek side of the upper back teeth and the lower towards the tongue side. And that's typically where you will end up with plaque and calculus. I have already mentioned that this is an area that is very important, that is brushed nicely and effectively. So placing the brush onto the gums, flicking it towards the teeth. So that's something that I really recommend, especially for those who have lost some gums or the gums are already slightly compromised for whatever the reason, as we will go into detail of those on a different video. Now, when it comes to maintaining your regular health of the gums, a routine for a young healthy adult should be just allowing the brush to go round and round along the teeth, including the neck of the teeth, which is essentially where the gums come in contact with the teeth, and you maintain that careful flow all around the teeth. So when it comes to flossing, you can follow this traditional method, twist it around the fingers, pass it between the teeth. Brilliant. If you can do that, excellent. Not everybody's got the dexterity for that or patience for that. Either way, we can currently use floss handles. So they are harp shaped, but typically the ones which come at this angulation, they will allow the floss to pass between the teeth nicely, and you will be able to pass it through these contacts and move it side to side. So it goes side to side like a saw between the teeth, as if you're sawing between the teeth, and rather than pushing straight in. That way you will not hurt the gums, and slowly steadily the contacts will get smoother. It will become easier. It will get it much more easy to get your floss done. Third thing that I really insist upon is rinses. It does make a big difference. Now, whenever I mention rinses, the first response is mouthwash. No, not necessarily. Water is good enough, but must be done within the 10 minutes to 20 minutes after eating anything. Within half an hour is okay, but must rinse. And rinse should be vigorous enough to feel the water swish through the gums. You should feel that going through any loose gums that are there. These loose gums get a plaque and you're unable to brush, especially once the plaque has established in between them. So vigorous rinses, flush anything stuck between the gums and allow them to nicely clean. That will be the major tip of the day. Okay, while we're continuing on the subject of brushing, the side surfaces of the teeth, round and round, careful brushing, don't scrub too hard. Top surface of the teeth is okay to give a good scrub, but the gum margins, round and round, careful brushing is important. That's where the electric brushes make a big difference, as they will do that for you. Similarly, the inner surfaces of the teeth must not be forgotten. Next to the gum margins, all around. The top, far back, going behind the teeth, the palate, it must be cleaned. Smokers, beware. This is the region that you will often end up with gum disease. So a little more careful brushing. Not advocating smoking. You have to still stop that. But gums towards the teeth, rinse, rinse, rinse. And we'll talk about rinses and the benefits of rinses in a minute. So a good scrub on the top of the teeth. Careful brushing comes towards the teeth. Inside of the teeth towards the tongue side, not to be forgotten. Top, far back, careful brushing. Flossing now. You floss by passing the floss through the teeth and moving it carefully side to side. That's where the water picks and devices like that have come into market. They're brilliant devices. I love them, for they will clean the gum margins quite nicely. So gum margins means that they will clean between these points in between the gums. They will not be as effective in cleaning the contacts where the teeth come together. And these contacts preferably should still be flossed by a physical cord passing through them. That is why I often have an issue with the name of the water flosser, because they are not essentially replacing the floss itself. Now, previously I've mentioned how to floss. and I've spoken about these floss sticks or the harp shaped sticks, which I said some are better than the others, and this is one of those brands. It tends to work quite effectively, quite well. Essentially, you can see it's not at a straight angle, it's a harp shape. Okay, so here we are. So you basically got the contact here, right? And you will pass it through the contact by moving it side to side. So side to side, as if you're sawing through the teeth, and it will gently go down and gently come out. That's how you floss. So you do not want to push it straight down and hurt the gum. So be gentle, side to side, carefully passing through the teeth, and that will work really well. This is one of the brands. There are quite a few different brands. Also, when it comes to starting flossing the first time, it will be a good idea to use something like a dental tape or a waxed floss. It's a bit easier. It will pass through the teeth quite nicely. So dental tape, satin floss, waxed, all these versions and variants are quite readily available. Tapes are easy to pass between the teeth, will allow you to floss easily and hopefully getting you into the routine of flossing regularly. If you are struggling with the floss, that is a good way to start with one of these kind of harp shaped floss holders, and go for the thinner versions, which are the tapes. All the best. Thumbs up.